Welcome to my podcast. Today I'm going to talk about another common case that you can see in the clinical setting, and it's common here in the UK. So basically, after you introduce yourself and double check the patient name, date of birth, as always, we agreed. We need to ask the patient, how can I help you today? The patient will be stating that that she has this sort of facial swelling that she noticed, and there is redness, and she knows that her skin pores, it's quite obvious, it's enlarging, and she's not happy with that. And also, we always know, usually women or ladies or young girls, they don't like this sort of flushing or redness or anything in their face, and especially with skin pores. If it's obvious and it's open, they're gonna try all sorts of skincare. They find it at the chemist or in the store, and they just I'm not happy about the whole situation. So you will ask the patient, do you have any idea what might be the reason for this? You will ask also if the patient had this symptom before. You will ask the patient if he's taking any medication or any sort of skincare that presently they just started. So you need to ask all of that. You need to ask about any medical history the patient might have. The patient will say that I have plaque, psoriasis, and rosacea, which I'm taking for medication. And you'll ask what sort of medication. The patient will say, I'm getting this injection for the biological, which obviously recently used for the psoriasis, and it's like a revolutionary. However, there's some of them, they have side effects that the patient should be aware of, and the patient will say, for the past year, I'm taking biological, that's interleukin 23 inhibitor. I'm taking also, and I'm applying topical tacrolimus for the face. However, for the skincare routine, she hasn't changed it, so it's the same thing that she used, some tonic and some cleanser and some cleaning that she does, and probably she's doing a facial as well. So you will need to examine, and of course you need to ask about family history, what sort of job the patient does, or if she's a student, their lifestyle, and their social life. And then you will say to the patient, if you don't mind, I would like to have a quick look on your face and just to examine what is the swelling and all about it. So you will notice that there is erythematous papules, generally speaking, on the nose, around the chin, cheek area, and you will notice that the skin is sort of thickened with enlarged pores. However, there is no comedones and pustules. So in that situation, you need to have some difference in your mind. So as I mentioned, there is no comedone, no pustule, so this will rule out acne. And as the patient history, stating that she has rosacea, so you need to think about the rosacea. And obviously, as the patient says that they have this sort of skin thickening, so you'll think about hyperplasia of the sebaceous gland, and probably hair follicle dilatation with chronic inflammation. So you'll think about phytomatous rosacea. And in this condition, as I mentioned, the patient has swelling, so you will look for the nose, for rhinophroma, for the ears, autophoma, for the chin, grantophoma, forehead, and metaphoma, and eyelids, blepharophoma. And you just decide which area is basically affected and how it's impacting the patient. The patient might be happy, looking all the time in the mirror, feeling like it's affecting her body image and the way how she look. Maybe the patient is working in a situation where that they need to deal with clients, so they are not happy with their face. They might want to use anything to hide their face and the spots on the marking. And we know that rhinophroma, and when it's really swelling and growth of the in the nose, for instance, it's mostly seen in men, but in ladies usually between 20 to 30. And it's mostly affecting the North European heritage, which basically with fair skin. So the patient will complain that they notice that there's recurrent facial flushing, redness. They have those sort of popped small swelling, which is papule, and redness. You will notice that there is some telangiectasia, and you will look if there is pustule or not. And the patient might say at certain situations she has like burning, stinging sensation when the face goes red and with flares. You will ask also if there is any medication that the patient takes, for instance, for whatever things, like I mentioned, for the medical problem she has. So it might be also a drug reaction, which could be more florid than this one, of course, obviously. So you need to put in consideration as well. And you will ask about the triggers once you just thought about rosacea. We know that rosacea get triggered by extreme temperatures, like for instance hotness or coldness, and also with the sun exposure, and also with spicy hot foods, and with alcohol beverages, and strong wind, and if the patient is stressed, or if there's or the patient doing certain exercise, all of that is considered to be a trigger. However, the pathogenesis is still not clearly explained, but it's stated that it has linked to environmental factor, if it runs in the family. Certain microorganism has been, as we all know before, from demotics, mites. Also, it's been stated that H. Helicobacter pylori has a link in one way or another, and it's linked to neovascular dysregulation as well. So in that situation, as the patient is using tacrolimus, and maybe the topical is ineffective, especially if there is growth and hyperplasia of the sebaceous gland. So you could consider, firstly, oral doxycycline in a dose of 40 milligram once per day, or low-dose isotretinoin, which is ranging between 0.3 milligram per kg per day in small dose. Explain to the patient it could, of course, slow the disease progression, but there is no guarantee, as we always know. And in severe cases, for instance, if they have like big nose or any enlargement, in those kind of cases, when it's really severe and debilitating and affecting the patient thoroughly, you need to consider debulking of the exist tissue. Before they used to use scalpel, but nowadays they use ablasive laser. So whereby they're gonna cut the exist tissue, and it has, of course, while it's cutting, it's gonna burn the area in order to stop the bleeding. And of course, you need to counsel the patient for those triggers in order to avoid them, and consider using sun protection as well, and moisturizer. So it's kind of tricky. It's not easy. It's not straightforward. There are certain things that you need to try, and also to avoid anything that might cause the trigger. And it's common. I do see a lot of patients sometimes. In the street when you walk, you can see and you can tell this is rosacea, or and some of course I do see some men, they have quite obvious large nose, which fits with the rhinophoma. However, apart from otophoma and gantophoma, metaphoma, blepharophoma, I haven't seen that quite obviously, but doesn't mean that there isn't. So this is one of the conditions which is common here in the UK, and you could see in the clinical setting, in the dermatology clinic as well. And you just need to be prepared how to deal with it, and how to discuss with patient, and involve them in their own treatment as well, and ask them what's their thought might be the triggers in order for the patient to understand their situation and how they can control, because after all, the patient, he's the doctor himself, who knows much more better than anyone else. And one way or another, they could know how to control and minimize symptom flares and stuff like that. So I hope by that I covered rosacea and how to approach it in a way that to deal with it efficiently and effectively. Thank you.